One of the male genital surgeries that we perform frequently is testicle prosthesis surgery. In some cases, one of the testicles of the patients may have been removed during childhood. How can this happen? The child could have been born with undescended testicles. If it was left in inguinal canal, it is removed because the possibility of it turning into cancer at later ages is high. So one testicle of the patient falls short. This patients generally come before wedding to make up this shortage. In this surgery, they do not want the surgery scar to be seen. To make it invisible, we put the prosthesis in from the back side of the gonad. The suture marks are not seen from the outside. They are not seen by looking from the front at least. The surgery does not have many key points. Detecting the size of the testicle and the prosthesis to be implanted well is necessary. It should be equal to the one next to it. For this, there are testicle prostheses of various sizes. The difference between the two is unrecognizable if a suitable size prosthesis is used. Besides, it is needed to determine on which side the lacking testicle of the patient is. It is absolutely necessary to examine the patient standing and in bed separately. Also, it is needed to talk to the patient very clearly because it may be difficult to understand whether the missing part is on the right or the left side during the operation or in an admitted patient. By an examination, a very good physical examination is required. As I said, surgery is mostly asked before the wedding, and the brides being not informed is requested. My advice to patients with this type of desire is to come at least 3 weeks in advance and have the surgery because the stitches and the incision lines healing takes 2 weeks. For 2 weeks there will be stitches. After 2 weeks we can take the stitches off if they have not dissolved by themselves, but it has to recover a little. Therefore, it is beneficial for them to come 3 weeks or even a month in advance. Normally, because we do the surgery from behind, the stitches scar is not noticed, even if the patient is naked or viewed from the front. If the size of the prosthesis is chosen correctly, it cannot be noticed. If it is silicone, as consistency, the implanted prostheses already resemble normal testicle consistency in men. Usually these prostheses are not changed, they remain for a lifetime. However, I recommend replacing it if capsule formation occurs. Sometimes capsule formation also occurs in prostheses. Years later, the patient comes to be examined. A hard tissue is formed that surrounds the prosthesis tightly. If such thing has occurred, it is useful to open it by surgery, clean the capsule tissue around the prosthesis and replace the prosthesis with the new one. It is not a very problematic or detailed operation. The surgery takes a short time, so it is satisfying. If you ask me if it is ethical that the patient does not want the bride to know about it and not to understand that there is a prosthesis, I mean, women also have hymen surgery before the wedding. I think this surgery is more innocent than that. After all, it is one of the genital aesthetic done to the man before the wedding. We can even say that it never leaves a mark because it stays behind. You need to lift the scrotum and look between the legs to see it. As I said, it is usually a short surgery that makes one happy. If patients do not know that it can be corrected, after this video, the viewers have probably understood it because there are many people who do not know that this can be replaced with a prosthesis and walk around with a single testicle. I hope it will be heard and help patients.